Hello family, welcome back to another amazing episode of the 𝐒𝐲𝐬𝐬. As usual, hope you're doing amazing and you're taking steps to prioritize your health and your well-being. Now the gist for today is something very important and something most of us are actually familiar with, but actually very serious. Now what's this we're talking about? Today we'll be focusing on stroke, also known as cerebrovascular accidents. Now during the course of the discussion, we're going to be talking about what stroke actually is. Now also we're going to talk about things that people do that make them more likely or increases the chance of their developing a stroke, as well as we're looking at some of the signs or things that you can look at to enable you know when someone might be developing a stroke and what you should actually do next should you be in an environment where someone is having a stroke. So grab a snack, get your drink, get comfy, and let's dive into the gist for today. Welcome back, guys. So first we begin by looking at what stroke actually is. Now stroke is also called cerebrovascular accident. You heard me right, stroke is actually an accident. Now who are those involved in this accident? Well, like I said earlier, stroke is a cerebrovascular accident. Now when you hear the word cerebral, it refers to the brain, and then when you hear the word vascular, it refers to the blood vessels. Now don't forget, the blood vessels are like the pipes in the body that are responsible for transporting blood across the body. So stroke is an accident that involves the brain and the blood vessels. Now it happens when the blood flow to the brain is interrupted or cut short, and this can happen for quite a number of reasons. Now for the purpose of this discussion, we're going to be talking about the two main types of stroke. Now the first is what we call ischemic stroke, and the second is what we call hemorrhagic stroke. Relax, I'll be explaining what this actually means. So when you hear the word ischemia, it simply means lack of blood flow to a particular area, and then when you hear the word hemorrhage just simply means bleeding. Now ischemic stroke happens when the blood flow to the brain is interrupted. So blood flowing through the vessels taking blood to a particular area of the brain is obstructed or is interrupted or is cut short. Now with hemorrhagic stroke, on the other hand, blood flow to the brain is interrupted not as a result of a blockade within the blood vessels, but because the blood vessels taking blood to a particular area of the brain ruptures or bursts open. Yes, that's for the hemorrhagic stroke. Now before we move on to some of the warning signs that you can look at for to know if you or your loved one may be developing a stroke, let's quickly talk about something that most of us would have heard about. Now that's what is called TIA, transient ischemic attack. So transient just simply means, oh, this thing is short-lived, and ischemic, like I said, an absence or a shortage of blood or an interruption of blood flow to a particular area of the brain. Now most of us would have heard the word or heard somebody say, oh, that man suffered a partial stroke, that woman suffered a mini stroke. Yes, this is what they're actually talking about. So transient ischemic attack usually occurs when there is an interruption of blood flow to a particular area of the brain, but however this interruption usually only lasts for a few minutes to few hours, and the symptoms that this patient will have as a result of this interruption of blood flow to the brain usually resolves within 24 hours. Now it's important we actually know about this and talk about this, because usually a TIA, or that's a transient ischemic attack, may be a warning sign that there is an imminent or an impending stroke about to happen. So should you or your loved one suffer a TIA, please do it to visit the nearest hospital immediately, where you'll be properly evaluated and given medical attention that you actually need. So what actually causes stroke? Now there are quite a number of things that increases the likelihood of a person developing stroke. Now the first on my list is uncontrolled hypertension or uncontrolled high blood pressure. Now we talked about hypertension in a previous video. I'll be leaving the link in the comments in the drop box. Do wait to go and rewatch that video, as we talked about what hypertension actually is, risk factors for developing hypertension, if you have hypertension, how you can manage your hypertension and ensure that it's controlled, as well as, oh, if you want to prevent yourself from developing hypertension, what you can actually do. The second thing on my list is uncontrolled high blood sugar or uncontrolled diabetes. Also conditions like dyslipidemia. This usually is when somebody has a lot of fats or cholesterol rather in their blood. This also increases the risk of developing a stroke. Obesity too is an increased risk factor for developing a stroke, and then if you've previously had a stroke before, then your risk for having another stroke is also increased. For people that have had a transient ischemic attack, that's the TIA that we talked about, their risk for also developing a stroke is also increased. Now, apart from that, it's been found that with increasing age comes an increased risk for also developing a stroke, lack of exercise, sedentary lifestyle. Basically, the cardiovascular risk factors also increases your risk for developing a stroke. Now, there's something people also might engage in that actually increases their risk for developing a stroke, but most people do not actually pay attention to it. So there's some chiropractic practices that people engage in, like neck massage, that increases their risk for developing a stroke. So during this neck massage, the blood vessels supplying the brain may actually undergo minor tear or micro tears that you might not actually see with your visible eye. So you might not have like an overt bleed. So you do not actually know that there was a micro tear in the blood vessels. Now what happens is that the tear in the blood vessels, the micro tear, the very tiny tear on that blood vessels is going to be healed. And then usually when the tear healing usually would heal with the formation of blood clots. Now, these blood clots can get dislodged and then travel to the brain. Don't forget that the neck is very close to the brain, so it's easy for this blood clot to dislodge and then travel to the brain, obstruct the blood flow to a particular area of the brain, and now cause stroke in this patient. So now that we have known some of the risk factors for developing a stroke, we'll now be talking about how you can quickly identify signs of stroke or an impending stroke in you or in your loved one. Some of the symptoms of stroke would include sudden onset of weakness or numbness involving the face, the arms, and the leg, sudden onset of severe headaches, sudden onset of blindness involving one eye or both eyes, sudden onset of difficulty in speaking or even understanding speech, sudden onset in difficulty in moving a particular part of the body. Now, when you notice someone having some of the symptoms, then you quickly want to act fast. You want to act F-A-S-T. Now, F stands for the face. So you want to look at the face of this patient. Does the face of this person appears shifted, tilted towards one side, or when a person is talking to you or smiling, does this appear as if the person's mouth is drooping to one side? So you want to look at the arms of this patient. Now, when the person raises both, you ask the person to raise up both of their hands. When the person raises up both of their hands, if you notice that one of the hands is drifting downwards or moving downwards, usually that is indicative of the fact that that part of the body is having a weakness. They also want to assess the speech of this patient. The S stands for speech. So when the person is talking to you, is the speech clear or the speech is slurred? And also, can this person understand the speech that you're making? Can this person understand what you're actually telling them? And lastly, the T. T stands for time. So with stroke, the key to management of stroke is timely presentation. So usually when you notice anybody having all these symptoms or any of the symptoms that we have mentioned, you quickly want to take this person immediately to the nearest hospital, as early presentation will help to reduce the damaging effect of stroke on the different parts of the brain. So what can happen if you do not get to the hospital quickly enough, or you do not seek proper medical attention? Now, the unfortunate thing with stroke is that the more you delay in seeking medical attention, and the more widespread the damage to the brain becomes. Now, with stroke, the damage does not just remain at that initial point that happened. The insult does not just remain at that initial point, but it begins to spread to affect other parts of the brain that were not initially affected. Now, this can now lead to suffering permanent brain damage. So the patient will now develop things like physical disability, so they suffer things like muscle weakness, numbness, or paralysis of one part of their body. They could have speech and difficulty problems. So you now notice that, you're not able to speak like you used to before. You can't speak properly anymore. And then even when people are speaking to you, you might have problems processing or understanding what they are saying. And apart from that, there's visual abnormalities or visual impairment rather that also comes with stroke. So you could suffer from blindness, double visions, or other visual impairment too. Now, there's also the cognitive impairment that also comes with stroke. So you cannot have the patient can suffer from a memory loss or problem of memories, problem of attention, and they now notice that the speed at which they process information or things that has been told them is also now affected. Now, apart from that, there's a problem of swallowing too. Now, don't forget, with problem of swallowing means that the rate at which this person takes in food or takes in fluid is also going to be affected. So we're now also going to be talking about problem of nutrition and hydration. And lastly, with stroke, there is the risk of death as a result of the progressive damage and widespread damage that has been done.
So lastly, like they say, prevention is always better than cure. So how do you now prevent yourself from developing a stroke in the first place. Now, the key to prevention lies in the control or making some adjustment to those risk factors that we have earlier mentioned. Now, these risk factors can be divided into two groups: the modifiable risk factors and the non-modifiable risk factors. So, non-modifiable risk factors are those risk factors that really you can't do anything about. Take, for instance, increasing age. You can't reduce your age. Now, but the focus for prevention is usually geared towards the modifiable risk factors. These are risk factors that you can actually do something about to control. So, if you're hypertensive, you want to ensure that your blood pressure is properly controlled at all times. If you're diabetic, you also want to ensure that your blood sugar level is well controlled. For people that have problems with cholesterol, high cholesterol in their blood, that's what we call the dyslipidemia. You also want to ensure that your blood cholesterol level is kept at bay or within normal range. So you seek medical attention for that. Do not forget that one of the risk factors that was identified for stroke is obesity. So you want to ensure that you're maintaining a healthy weight at all times. You want to ensure that you're exercising and avoiding a sedentary lifestyle. You're eating healthy, you're getting enough amount of rest, and you're developing ways to manage chronic stress. Now, apart from that, you also want to ensure that you limit the amount of alcohol intake. And lastly, you also want to ensure that you avoid or quit cigarette smoking or smoking in general. Now, that will be all for today. If you found this informative or helpful, do not forget to like, share, and subscribe. Now, if there are also some questions you have, do not forget to leave it in the comment section. We probably might be having some topics that you want us to talk about or cover in the next episode. Also, do not forget to leave it in the comment section. I'll see you in the next video.